To UNI's and MOVE's mental health workshop. This is our 7th seminar of our 12-month series. These programs go on the 3rd Friday of each month. They will be going on all the way until September, I believe, inshallah. Tonight we have the honor of Mona Berry and Zainab Busi. Our other speaker cannot make it tonight, so they will be speaking on ADHD. So let's give them a big round of applause. Welcome.
Thank you. Assalamu alaikum. Thank you so much for having us here tonight, and thank you for coming. So tonight we are talking about ADHD, Attention Deficit Hyperactivity Disorder. Thank you so much. Okay, so as we begin, obviously, what is ADHD? So ADHD is a neurodevelopmental disorder that affects both children and adults. And it's described as this persistent, ongoing pattern of inattention and or hyperactivity and impulsivity that impacts their daily life or typical development. So individuals with ADHD have difficulty maintaining attention, difficulty with their executive functioning, and working memory. So when we talk about executive function, that's the part of the brain that basically calls the shots. It's the part that allows you to plan, to organize, to prioritize and put things in sequence, to start a task and complete it. So individuals with ADHD, the best way to describe that is that their executive function it's in a sleep mode. So they're not alert all the time, they're not aware of, they may take in the information, but they're not processing it to move forward. So I'd like to play a video that kind of gives you the idea of what ADHD is and how executive function plays into it.
ADHD, or Attention Deficit Hyperactivity Disorder, can cause problems in many different areas of life. Millions and millions and millions of children and adults all over the world are diagnosed with ADHD. That's a lot of people, so you are not alone. Myths, mysteries, and misinformation surround ADHD. However, we know it's more than just inattention, impulsivity, and poor organization. People with ADHD have deficits within areas of executive function that can affect them in many other ways. Let's take a closer look. Imagine what it takes to film a movie. There must be lights, actors, props, and scenery, and a camera. In order for the action to come together, someone has got to call the shots and be the boss, a director. A director on a movie set does what executive functions do in the brain: the ability to plan, organize, prioritize, sequence, manage time, and problem solve are just some of the skills needed to complete a task. But for the person with ADHD, the executive functions are not fully operational all the time. It's as though their director keeps falling asleep. ADHD is not a lack of skill or knowledge. Just like on a movie set, the actors, props, and lights are all there, but with a snoozing director, how can the project all come together?
Like this. Please wake up!
Okay. Well, let's see what we've got so far.
When the director's awake, he can look through the camera to play the scene back. People have an internal camera in their brain, which lets them see how their actions affect themselves and those around them, in order to make sure their behavior is appropriate for the situation they are in.
Who put their dirty fingers on the camera?
Oops!
Sorry, boss. I gotta stop falling asleep.
There are lots of things you can do to wake up your director, clean your camera lens, and increase your confidence as you go through life. Succeed. Don't just survive.
So just as the video showed you that on a movie set, the director has to be alert, awake all the time to be able to help the actors stay on task, on cue, to film the video, make sure that the set and everything is functioning properly. That's how the individual with ADHD has a hard time completing all those tasks. again, because of the fact that their executive functioning is, which, as I said in the video, is asleep. It just needs to be a little more alert and more awake. So as we dive in, we'd like to talk about some of the myths that you may have heard about what ADHD is or is not. We do have a handout, because I know this is very small and you can't really see it, but there is a handout up at the desk. So the first myth says that ADHD isn't a real medical disorder. Fact is, like I stated before, it is a neurodevelopmental disorder, and it does affect 11% of school-age children. So it is part of the DSM, which is the Bible for mental health professionals, such as psychiatrists, psychologists, as well as us social workers. We don't diagnose, but we do reference a lot to it when working with our student population or our clients if we're in therapy. Did you mention the next one?
Yeah, sure.
Okay.
So the second myth is children who are given special accommodations because of their ADHD are getting an unfair advantage. Because it's a medical diagnosis, we can't just automatically say that these kids are like quote unquote bad kids and we can't give them extra accommodations. Because the executive functioning is hindered, they do need more time when they're doing their assignments or working, and the extra time will give them that processing to really kind of organize and see what the next steps are with what they need to do. So we can't say equal is fair. And just because we're giving accommodations for children with ADHD, it doesn't mean that we're giving them extra help that, because we want to. No, there's a reason behind it, and they need that extra time and extra accommodations.
Because we want them to also learn to be successful. We want them to feel success, just as we would want a student who is not diagnosed with ADHD. Myth number 3 says that children with ADHD eventually outgrow their condition. This is not true. ADHD is actually can continue into adulthood, and it is a lifelong issue.
So myth number 4 is ADHD only affects boys. So working in the school district as school social workers, this myth can be completely thrown off the table. We see the symptoms of ADHD with hyperactivity and attention with both boys and girls. They can be either hyperactive or inattentive or combined. So it can hit, so there's no gender discrimination. It can hit for both boys and girls.
We just tend to see it more in boys because boys tend to externalize the symptoms more than girls do. And that's why you will see more boys who are hyperactive, aggressive, they have a hard time focusing, very impulsive, doing things without thinking. Whereas with girls, they tend to internalize some of the symptoms. So a lot of times you'll find that the girls will be diagnosed more with inattention than they are with the hyperactive type of ADHD. Okay, myth number 5, ADHD is a result of bad parenting. So I know working in schools, we hear it a lot from teachers about why can't they teach their child to raise their hand, to talk, why can't this boy sit still, why can't they follow the rules? Well, it's not about parenting at all. It's actually the child does not have the self-control to control their impulses. Sometimes they do things without realizing, oh, this is gonna cause a problem, or I just, blurt it out, and now I'm going to be in trouble. It's after the fact that they realize that they did something wrong. And for parents who have children with ADHD, they have to learn how to handle a child with ADHD. And it's not about punishing the child for the symptom, because that only worsens the symptoms. It's about learning how to provide consistency, structure, and routine when having a child with ADHD.
Myth number 6, children who take ADHD medication are more likely to abuse drugs when they become teenagers. It's a myth because it's usually the opposite. On untreated ADHD, what ends up happening is as they get older, they start self-medicating because they know that there's something in them that is out of control, something is different about them, and when there's no diagnosis, they start kind of looking for other answers. And they go towards drugs because they want to feel good, and it's kind of like an instant reaction. So that is a myth because once you're on medication, which medication is one of the treatments, it does, take control of the hyperactivity, it decreases it, they're able to focus more, and then feeling more successful. They feel like, okay, there's whatever quote unquote is wrong with me, I know what it is now, and I know what I need to do to work at it.
Just one of the
reasons that so they don't get treated, the impulsivity itself.
Right.
So
Right.
some people think ADHD is just about inattention, but
No, it's
one
not.
of the questions I ask my patients, my adolescents and children or their parents is like, when I do a history, is, you know, did your kid ever, you know, did he always walk by his sister like, did he flick lights? Did he like, you know,
Right.
you know, do these like little annoying things like that? Because that really is the hallmark of a lot of ADHD, is that impulsivity. And that impulsivity, as you get older, becomes risk-taking.
Right.
Yes.
So if you don't get it under control, and unfortunately the stigma about ADHD medications is that they're drugs and
they're addictive,
yeah,
right.
but but you know, they're very safe, they're very well studied, and if someone really does have ADHD, they're gonna develop oppositional defiant disorder, conduct disorder is gonna get worse.
Right.
And that's why appropriate treatment, if it's under a doctor's care and it's monitored and there's follow-up, can be very successful for individuals that do have ADHD. But again, it's not the cure-all and the be-all, so you have to be very careful. But with medication treatment, it can reduce the risk of drug abuse later on as adults. And then our final myth is that people with ADHD are stupid or lazy, and they never amount to anything. We know this is false. There are individuals who are diagnosed with ADHD and they're very highly intelligent. They just have a little things that kind of keep them from being able to focus or complete tasks. But there are some very successful individuals that I will show you at the end of the slide that are living currently with ADHD and are very, very successful financially and in their lives. So just to kind of recap, so attention deficit hyperactivity disorder is a mental disorder, and it does often occur in children. Currently 6.4 million children, American children ages 4 to 17, have been diagnosed with ADHD. And as we discussed, that boys and girls do display very different ADHD symptoms. So as we talked about with the boys, it is obviously external, and that's why we tend to see it more with our male students than we do with our female students, because they do show more of the acting out, the running, the hitting, the lack of focus, and the physical aggression.
And just like I talked a little bit before, there's different types of ADHD, and there's 3 different types that we're going to talk about in this presentation. One is just strictly inattentive, so they have a hard time staying focused. Hyperactive and impulsive, where we'll talk about symptoms of that. And then there's also combined inattentive and hyperactive impulsive.
So when you're looking at the criteria in diagnosing ADHD, the inattentive type, which is without the impulsivity and the hyperactivity, we reference the DSM-5. According to the DSM-5, 17 and younger, they need to have 6 or more of these symptoms, and they have to be present for 6 months. And then they have to be inconsistent with the child's developmental level, and they have to have a negative effect on their social and academic activities. And when we say that, they have to be endorsed with often, and that's when you're completing scales. If you as a parent are answering the questions about your child, if you endorse that these things are happening often, that's where they will be able to diagnose. So some of the characteristics of inattentive presentation, again, like Zainab touched on, is that they fail to give close attention to details, they have difficulty sustaining attention, they appear to not listen, sometimes they appear like they don't have any motivation, they may be shy or withdrawn, and they tend to lose things, and they're easily distracted. Now, in diagnosing this in older teens and adults, the DSM-5 states that there has to be, I believe, 5 of the symptoms in order for it to be diagnosed. Now, that's not to say that an individual that has this doesn't have strengths. The strength that they do have is that they're creative, they're intelligent, they have problem-solving skills, and they're determined. But their weaknesses are that they do have difficulty with change because they're afraid. They may have problems with punctuality, arriving on time, and they may have fear of expressing their feelings, and an inability for them to relax, to reduce anxiety, and sometimes they may seem depressed.
The hyperactive impulsive criteria for ADHD is 6 or more of the following symptoms must be present. Same thing as for the inattention, for at least 6 months, and it should be negatively affecting whether it's their social life, their school life, or academic activities. And this would include fidgeting with hands or feet or scrums in chairs. So if you see a student walking around, pacing, isn't able to sit in a chair, that would be considered a hyperactive impulsive. Has difficulty remaining seated, runs about or climbs excessively in children, extreme restlessness in adults, Difficulty engaging in activities quietly, so those who are blurting out, and it could be just words, random words, or just inaudible, just sounds and making noises. Acts as if driven by a motor. So when you see a child and you're like, wow, that child has so much energy, they can't, hold it together, that's also a symptom of hyperactivity and impulsivity. Talks excessively, loud interactions with others, blurts out answers before questions have been completed, so they have a hard time stopping, raising their hand, waiting to be called on, and then saying the answer. So they kind of miss that whole process. Difficulty waiting or taking turns, and may have a quick temper, and that's that impulsivity.
And so the combined inattentive and hyperactive impulsive type has a combination of both. But just keep in mind that the symptoms do change over time and with age, and children do display these symptoms differently.
So there's 3 levels of severity of these symptoms. There's mild, moderate, and severe. And again, it depends on the intensive, comprehensive evaluation that is taken from the parents, the teacher, and the child, him or herself. Mild is just a few symptoms beyond the required number of diagnoses are present, and there's a minor impairment in socialization or academics. In my experience, we have students who show and exhibit signs of ADHD, and they are academically doing amazing, and they are socially fine, and at home there's really no issues. But then you'll hear the parents say, oh, they have ADHD. There's a criteria for it. To be mild, it's just a mild impairment. Moderate is functional impairment between mild and moderate are present. It depends on the level of severity. And severe is many symptoms are present beyond the number needed. So if the minimum is 6 and they have the full 9, that would be a severe level. And it's marked an impairment in social, academic, and in the work settings.
So what are the causes of ADHD? Obviously, multiple studies have been conducted, and they have yet to be able to determine the exact cause of ADHD. However, there have been studies, and scientists have discovered that there is a strong genetic link, since it does run in families. But there are factors that are taken into consideration that could increase the likelihood of ADHD. It could be a brain injury, it could be lead or pesticide exposure at an early age. It could be if you had an older parent at the time of birth of the child, or premature birth or low birth weight. But other factors that are not known as causes of ADHD, but can make the ADHD symptoms worse, is if the child is spending way too much time, like excessive time watching TV or playing video games, eating a lot of sugar, because diet does come into play as well. Family stress, if it's a low socioeconomic status family who are living in poverty, or if there's a lot of conflict and chaos in the home, that can also worsen the symptoms, and if there's been any traumatic experiences. And again, this is a brain-based disorder. So a lot of studies have also looked at the size of the brain of a child who has ADHD in comparison to a child who doesn't. And children with ADHD tend to have a larger brain size than children who do not have ADHD. I know this is really small, so we do have a handout for this as well, and it is at the table. And so we also wanted to present to you that ADHD can also coexist with other conditions. 2/3 of individuals with ADHD have at least one other coexisting condition. I'm not going to go into details about every single one of them, but I will touch on what they are. So in the neurodevelopmental disorders, which is the first set of circles up here at the top, a coexisting condition that can occur with ADHD that we talk about and see a lot in the schools is learning disorders. So you could have a child who's dyslexic, so they may have reading problems, or you could have a child that has math calculation difficulties. So the treatment options for that is that's where IEPs come into play, or educational evaluations come into play in the schools, and we do special education services, and that's where the accommodations and the modifications come into play. Speech problems is another coexisting disorder that can occur, and that could either be stuttering, it could be articulation issues, it could also be issues with pronouncing words correctly, and that again, that's where they could get speech services for that. And another coexisting disorder would be Tourette syndrome, and that's motor tics or vocal tics as well. Other coexisting conditions are anxiety, substance abuse, sleep problems, conduct disorder, and oppositional defiant disorder. Again, this is also very common that we also see in the schools, more with our older elementary students, and also middle school and high school. And then there's depression and bipolar disorder as well.
And just to talk a little bit about depression, you know, we don't know if one, you know, affects the other, but for depression, especially in a school setting, we see when a child doesn't feel successful, they don't feel motivated, and then they're trying, and they're just not getting anywhere. And if they don't have that support around them to help them feel successful, depression can play a role because they start feeling sadness, they start isolating themselves from students or you know, peers or their families. So it's really important to also, you know, when there's a diagnosis, to also treat and make sure that it's not going to develop into another diagnosis.
Okay, so treatment. To fix ADHD, one does not simply say, try harder. It doesn't work that way. So when we're looking at treatments for ADHD, So when we're looking at treatments of ADHD, it's very important that you have a multi-model approach. So you're looking at medical, educational, behavioral, and psychological interventions. So what does this involve? So we're looking at parent training, we're looking at medication, you're looking at skills training, you're looking at counseling, behavior therapy, educational supports, and education regarding what ADHD is. And treatment has to be individualized. So it's not a one-size-fits-all approach. And again, medication and behavior therapy, a combination of that is the most effective treatment for ADHD. These are just some of the treatment statistics that we came across recently, that when we're looking at children who are diagnosed with ADHD between the ages of 2 and 7, only 2 out of the 3 were taking medication, and less than half actually received behavior treatment in the past year. What's alarming is that 1 out of 4 did not receive any treatment at all. And these are the people or the individuals that if it goes untreated, these are the ones that could be at risk of developing more of the coexisting disorders such as depression, bipolar, substance abuse. Yes. And it will affect their social life, their careers, their education.
So combination is what's important here. Is if there's a psychiatrist or a medical doctor prescribing medication for a child with ADHD, it is equally important to be receiving therapy hand in hand, because that is what's going to help. As soon as the symptoms are decreasing, they're going to be educated about what ADHD is. Parents are going to learn parenting skills and how to, instead of telling your child try harder or snap out of it, there's other strategies that they can use at home, and then also involving the school setting to accommodate, you know, their workload or their assignments to that level.
So some of the behavioral therapies that are used when treating individuals with ADHD, cognitive behavioral therapy is mostly used with adults. And what is that? That is basically focusing on thoughts and behaviors that occur in the here and now. So when individuals are engaging in CBT, they are working on skills to help them overcome the difficulties that they're facing in their executive functioning. So they're looking at ways to manage stress. They're looking at ways to reduce some of the symptoms of ADHD that they're experiencing that are affecting their careers or their relationships or their education. The other programs such as parent-child intervention therapy, parent management training, and positive parenting program, those programs focus more on educating the parents about what ADHD is and how to handle a child with ADHD. So the focus of that is really on building that positive parent and child relationship. It's teaching the parents consistency, routine, teaching them when to give praise, how to use positive reinforcements, and how to instill consistent consequences so that you're not punishing the symptom, but you are, I don't like to use the word punish, but that you're providing a consequence specifically for maybe the child didn't follow the rules that they were already aware of. So these are the things that they work with the child on. And then with the parents, what's great about these therapies is that it helps them to reduce the stress of having a child with ADHD, and when that stress is reduced, then the child is less argumentative and is having less tantrums. So all of it is really focused on parenting skills and improving that parent-child relationship. And then when it comes down to the behavior therapy and the social skills training, that's more focused on the individual patient themselves, and it's focused on self-control, anger management, organization, and the skills are skills that they're taught that they can use throughout their adulthood as well. So what parents learn when trained in behavior therapy, again, positive communication, because if you're a helicopter or very harsh parent and you're coming down hard on a child who has ADHD, it's only going to worsen the symptoms, and it's going to cause a negative relationship between you and the child. And then again, with the positive reinforcements, you want to learn how to give those positive reinforcements, not the bribing or, if you just sit still, I'll, give you ice cream or something. So that's not how it works. It's got to match the behavior. And then again, with structure and discipline, that's what ADHD students really need, is consistency, structure, and appropriate discipline. Okay, so medications. These are just some of the types of medications that are used in the treatment of ADHD. So we have stimulants and non-stimulants. Some of the names may sound very familiar to you. Adderall, Ritalin, Concerta, Focalin, Datrina, Metadate, Methylene, and Dexedrine, and then non-stimulants as well. And there are also medications that are used primarily in the treatment of depression or anxiety that are also used to treat individuals with ADHD. Now again, like I said before, medication is not the cure-all for individuals with ADHD. It can help reduce the symptoms and the behaviors, but it does have side effects. So it's important to be able to read up on them and understand what are some of those side effects. And some of them that we've seen is poor appetite, difficulty sleeping. So just keep in mind that medication is an option, but it's a combination. So it's got to be medication and therapy together in order for it to be effective. And I'm sorry.
And in addition to that, it's also important to have an open communication with your doctor who's prescribing the medication, because one medication may not work for you. It's kind of a trial and error, and then you may, the doctor may say, oh, let's try something else to see if this will lessen the symptoms or the greater both.
Just kind of ease them, yeah.
Something better for them.
So one thing I've struggled with patients is if you prescribe a stimulant, the parents are like, oh my God. So stimulants are the most evidence-based treatments for ADHD, along with behavioral therapy and things like that, like the behavioral therapy and the therapy you guys talked about. Stimulants are the most evidence-based treatments. So if somebody's really struggling with ADHD, make sure that is not something to be
afraid of,
because they either take amphetamine or one of these medications, or they take heroin later on.
That's true.
Right.
And the non-stimulants are used, a lot of them, like guanfacine and clonidine. Clonidine, for example, is a blood pressure medication, but it really helps with impulsivity. So you don't use clonidine by itself, for example, to treat someone who has inattention. You're using it as a way to, if someone has impulsivity, if someone is violent or aggressive or has impulsive problems, like the thing I said, when they go and they just hit somebody, because the ADHD has that as a symptom. Not hit somebody, like with impulsive behavior. You use clonidine to kind of calm that down. For example, today I just had a patient that he was supposed to go home today, and he's one of these conduct disorder kids. So probably someone who likely had ADHD at some point and wasn't treated, but right now that wasn't even the concern. But today in group therapy, he goes, well, I want to take some guns and go blow up a hospital. He's not really going to do that, but that's like that impulsivity. And I'm just like, dang it, now you got to stay here so,
right.
Guess what he can do? He goes upon it.
Yes.
So,
right.
Along with the other medications. So don't be like, I had a patient one time that was a young adult who had ADHD, and I was prescribing her stimulants, and she went to a pharmacy here in Dearborn, and the pharmacy knows her mom's mom or some nonsense. And the pharmacist was like, oh no, this is that medication, that it should need. And she went to look for her, she's like, and then I get a call, and she's like, yeah, she told me it's not good, I don't know why I gave you this medication. I'm like, because you need that, that's the medication you've been taking. You had neuropsych testing, you have a serious problem from when she was younger, and now you're just going to stop taking it because the pharmacist told you. So be a little bit more combative with professionals. It's okay, tell them no, this is the medication, place some boundaries. I think part of learning some of this stuff at these seminars is to take this knowledge and actually use it, and not to just kind of be a follower, to kind of lead people to be a little bit brave in their own treatment and things like that. So that's just my view. I don't work for any of these companies, so I'm not.
No, but to touch on, I mean, they are research-based and evidence-based, and they do work, but it's got to be monitored. And that's why we tell our parents all the time, pay attention to them, and it's not a quick fix. So if they took it first thing this morning and you didn't see a difference, that's okay. There are time-released medications that do take a while once they enter the bloodstream in order before you start seeing any changes in behavior. And if it doesn't work, it's trial and error. And there are other medications out there that you can try, but you have to keep that open dialogue and open communication with the doctor.
And another thing is, I do drug tests on people who take ADHD meds, not to see if they're doing other drugs, to see if they have this drug in their system.
Yeah.
ADHD meds, because if they don't have this medication in their system,
They're not taking, yes,
exactly.
exactly. I mean, I've even had parents that have actually taken their child's ADHD medication just to see what it's like, what their child is taking and what it's doing for them. So, I mean, I don't recommend that. I do not endorse that or recommend that, but I do have parents that do that, yes.
There's a documentary on
Netflix?
On Netflix,
Take your pills.
That's one mother actually said that. She actually admitted, like, I took it to see what it does for my kid.
Yeah.
You know.
That's a really good documentary. I do recommend that you watch it. I'm sorry? Take Your Pills. It's on Netflix. Yeah. It's really, I mean, for me personally, it really gave me an eye-opening experience of what an individual with ADHD has gone through, and just watching that young man constantly write on his walls, take your pills, because that's all the focus was on. And that's why, I mean, we do say medication is important, but take it with precaution. I mean, for some, like I said, it's not the be-all and end-all. It's not going to cure you, but it will help alleviate some of the symptoms. But don't let it be the focus. And that's kind of what I took from that.
On the flip end,
Yeah.
I've seen clients who were anti-medication, and I'll see them week after week, and we'll try our hardest to work on cognitive behavioral therapy or the other therapeutic modalities, and there's no improvement.
Right.
And then sometimes they just have to kind of go through it on their own and face it and say, well, let me go and try it, because I tried the behavioral therapy and it didn't work. So, it's like they're convincing themselves.
Exactly.
And it's tricky because anxiety and depression can mimic some of the symptoms of ADHD. I know
That's true.
One of the seminars, I think I talked about my history of anxiety and hypochondria. But I know at the height of my anxiety, you can't really focus. So as a physician or as a social worker or as a psychologist, we really look. A good physician will look at the entire differential. Will rule out anxiety, rule out depression,
And trauma.
Yes.
and trauma. And for example, like I will treat. So if someone has anxiety, and I suspect ADHD, the way I practice, I'll first treat the anxiety first, and then see what improvements happen, and then treat. So it's not just like an easy diagnosis. I think that it's just
I agree.
Just throw ADHD out there.
I agree. So what do you do if you suspect your child has ADHD? So as a parent, it's important that I think that you speak with your pediatrician and ask for a comprehensive assessment. This is very important because a one-pager with, 20 questions given to a teacher is not the right way to go about diagnosing ADHD. It's very important to ask for a medical evaluation, educational, and psychological. Talk to your child's teacher. Ask, what is my child like in the unstructured settings and the structured settings? Because in the classroom, yes, they are asked to sit all day long, focus, write, read. But sometimes they go to gym, they go to the cafeteria for lunch. What are they like in those settings? And is it affecting their academics? So you have to keep that open dialogue with the teachers. And so some of the common scales that are used as part of the assessment is the Conners and the Vanderbilt. But again, like I said, scales don't determine diagnosis. So it's important to include parent reports, teacher reports, behavior observations, and psychological evaluations by trained professionals. So it has to be very comprehensive.
And the child's input.
Yes.
I think I get the most information is from the child, because when you ask them certain questions, like, how many friends do you have? And they, it kind of like, catches them off guard, and they say, one. Well, name that friend, and they can't name that friend. Their ADHD symptoms has isolated them from having peer interaction, and they give you an honest answer. What are you finding that you struggle the most with in the school or in the classroom setting? A lot of them who are exhibiting ADHD symptoms will say, I have a hard time listening. I have a hard time, or my teacher's always telling me to pay attention. I'm getting my cards
Right,
flipped, you know, the PBIS system. So do ask and get input from the child as well.
So in the schools, when we do, when it's brought to our attention by a teacher that, you know, I have this student, can't sit still, is always in fights, you know, constantly starting problems with other students, you know, the teacher will automatically say, I'm suspecting maybe there's some hyperactivity there. So as a social worker, I always collect background information. I sit down with the parents, I ask, what are they like at home? Because sometimes the symptoms of ADHD at home are going to look different than they are going to in the classroom setting. We know that at home, kids can come and go as they please, watch TV for as long as they want. There's no structure, you know, they're moving all the time. So to a parent, oh, they're fine, there's nothing wrong with them. But that's where we get detailed into the questions and we ask, okay, well, what if they start a task at home? What if you gave them 2 things to do? Are they able to do 1, 2, or do they get lost after the first word and then you come back later and say, hey, did I just ask you to do this? Why didn't you do it yet? And they're like, oh, were you talking to me? Or, you know, did you ask me? So there's a lot of things that we collect information from the parents about. So we do the interview, we do observations, and we do use the Conners to assess. Now, we don't diagnose, but it's definitely a way for us to give something to the parents to say, hey, this is what's going on at school that we're seeing. Take it to your pediatrician, have a conversation with your pediatrician, and then ask for a more comprehensive assessment. So some resources for parents that we have found is CHAD, which is a nonprofit organization, and what's great about it is they have an amazing website, and it's really easy to navigate, and they provide a lot of information about education, resources, programs for individuals with ADHD and families that do have children with ADHD. They provide a lot of partnerships for advocacy, and they also provide training for parents and teachers, and they can host educational webinars for you. Brain Balance I really like. It's not covered under your health insurance. And with the Brain Balance centers, the closest one to us is in Northville. What I like about it is it's not just strictly for individuals with ADHD, for children with ADHD, but it's also for children who have learning problems, are diagnosed with autism spectrum disorder. And what it is they look at the whole child. So when they're doing a treatment plan, they do also combine it with whatever your medical professional has given you, but their focus is on parenting skills, nutrition, social skills, and teaching the child how to manage the behaviors, as well as the parents how to work with a child who has ADHD. And then of course there's the American Pediatrics Association that you can also refer to, because a lot of times if you're looking for more information on ADHD, be very wary of the web, because sometimes you'll come across sites that are not giving you great information. Some of it is not research-based, so you need to be very careful with what it is that you're reading up on. But it's also very important to ask a lot of questions. Don't hesitate to talk to your doctor about any of your worries or concerns that you may have about whether it's medication, therapy, or even ADHD itself, because I do have a lot of parents that are very combative, and they'll say, what are you talking about? My child doesn't have this. There's nothing wrong with my child. When you discuss ADHD, you're not saying there's something wrong with your child. Again, you're just saying there's just some things that your child has a difficult time controlling or handling, and they just may need a little extra in order for them to be more successful at school or in life in general. So when I talked about individuals who are successful with ADHD, I came across this list online. Just to show people that, yes, there are individuals who are very successful financially and professionally who do have ADHD. Justin Timberlake, for example, which I'm sure a lot of people know who he is, he actually has been living with OCD and ADHD, and he is very, very outspoken about it. So some of these individuals have been the spokesperson for ADHD. For example, Adam Levine and Ty Pennington. If you ever used to watch Extreme Makeover's Home Edition, he was very successful in flipping homes and building homes. Howie Mandel, he's been diagnosed with OCD, mood disorder, anxiety, and ADHD. And he is very outspoken about his phobia of germs and his OCD-ness. Michael Jordan, Albert Einstein, he also had ADHD, Walt Disney, Jim Carrey, John F. Kennedy, and as well, so I came across Tim Howard, who is a World Cup soccer player, and he was diagnosed at the age of 11 with Tourette's, OCD, and ADHD. And these are very, very intelligent and successful individuals. So this is, again, to debunk that myth of individuals with ADHD will never amount to anything or be successful. So.
There's some viral infections that can cause that happen for the same person.
Oh, really?
The tics of ADHD.
Oh, okay. So just to kind of give you a look of what it's like for a child who has ADHD, this video gives you the experience of, I guess, walking in the shoes of an individual that has ADHD.
Don't forget the homework. And clean your room, we have company coming tonight. Oh, man. Oh, it's homework. Come on, Lily, how are you going? Gosh, I was looking for this. Took a trees for me to find this. And there. Awesome. Come on, Billy, let's go. Oh, yeah. You have your homework?
Good morning, class.
Good morning.
Everybody please take out your homework from last night. I'm going to pass back your quizzes from last week. Nice work, Billy.
Thanks.
Do you have your homework?
No, I think I left it at home. But I did it.
Okay, well, bring it in next class, all right? Before we get started, did anybody have a chance to look up yesterday's question on Washington, D.C.?
Ooh, my mom and dad took me to the Air and Space Museum.
I'm sure that was nice, Billy, but if you know the answer, please wait for me to call on you. Anybody else? Susie?
Washington, D.C. wasn't always the nation's capital. Philadelphia was the capital before that.
That's right. In fact, our nation had two capitals before it. The first one was in New York City, and the second one was in Philadelphia. And then it moved to Washington, D.C., where it's remained for over 200 years. All right, we're going to have a pop quiz. Please take one and pass it back. You'll have 15 minutes to complete the quiz. And please put them on my desk when you're finished. Billy, I only need one pencil.
Okay. Whoa! So cool.
Billy, please take your seat.
Fine. Okay, I'm gonna get this one.
Okay, everyone, time's up. Pencils down. Please bring your papers up.
But I didn't finish.
It's okay, bring your paper up anyway.
This just kind of goes over some of the things we talked about, but that was just to give you an idea of what it's like for a student who has ADHD. We see it all the time, so yeah. So you can kind of probably have some students in mind of who you think are like that, yeah. Yeah. Yes. Yeah. And it's actually the opposite, because you have some students who have ADHD, but their strength is calculations and math, and their weakness is the reading. Or it could be the opposite, where reading is their strength and calculation is their weakness. So it's just finding a way to work with those students to help them be successful in school. Any questions? Yes?
So a lot of the discussion is about, like, parenting and dealing with their children. What if you run into a scenario where, it's in a workplace, and there's a manager, his employee has ADHD. So it's more dealing with, instead of dealing with a child, you're dealing with an adult. You mentioned positive reinforcements.
Yeah.
What are like the best ways to deal with, because like in a child's view, it's more,
it's different.
It's more structured with a child. You can definitely lay down the rules and, try different things, but with an adult, you can't really tell them what to do.
No, you can't, and it's
because he's already developed, like,
right, and the combination,
you can't, right,
workplace as
right,
an adult.
Right.
But I think
you kind of have to have it, like, he's the employee, so how does like a manager deal with?
Well, it goes back to self-disclosure. Has that employee disclosed to you that they do have ADHD, or are you just suspecting that they have it? Because if you're just suspecting that they have it,
no, it's disclosed.
It's been disclosed.
You know they're taking medication for that.
Have they had that discussion with you? Have they discussed it with you? I think if they've opened the discussion with you, then I think it's okay for you to say, what are some things that you've done that help you to control, I don't know, I'm not sure exactly what it is that the individual is doing as an employee.
For example, like, it goes back to like the tasks. Right?
Yes.
So like when there's a given task, the manager will tell him, okay, here's the task. He'll know how to start the task, and he'll know how to end the task. But all the
in-betweens.
All the in-between is completely missed.
So can
Okay.
like breaking things up into
Right.
smaller tasks would help out? Taking breaks?
Visuals. A lot of times if they have it not necessarily in print, but also pictures that say, okay, step 1, step 2, step 3, and maybe giving them a checklist. And so as they're working, check off, okay, I just finished this. This is step 2, this is step 3, to kind of help them along the way. But that's why I asked if it was a self-disclosure, because if it is, then maybe you can have a conversation with them about what kind of things do you use that have helped you along the way when you were in school. So go back to when they're in school, if they're still in school, what are some things that are helping you in school in order to focus and finish your task, just to get them. Because I'm sure they're a good employee and you want them to stay there, so that's kind of the accommodation, is giving the checklist or the visuals, or breaking things down into smaller steps, maybe giving them 2 things to do, and once they're done, come back and say, okay, now let's move on to the next 2.
And I don't know how comfortable you are with this employee, but even having a conversation about, medication, go back to a doctor, are you seeing a therapist, because again, hand in hand is what's going to help this individual, and consistency and routine, so.
I think that's like the biggest thing is like ADHD. I noticed with ADHD people, they move fast. They move so fast they forget.
Sometimes too fast, right?
Yes.
Yeah.
Too fast.
And then it's
and like they feel like because they're at work, they have to finish the job fast.
A checklist?
Yeah.
A checklist would probably
Yeah.
Yeah.
I think more of like showing like visuals.
Visuals.
Work a lot too. As to like how,
Yeah.
like the only time you like, and a manager would see success in the employee is when they take medicine. You know, like even the ADHD adult.
Yes.
Well, his ADHD will come and play, and he'll forget to take his medicine. He won't take his medicine.
You're absolutely right.
So he'll come to work not on his medicine, and then it's a whole. Then the manager has to deal with that situation.
Right.
And you can't get rid of them.
No, but that's where I think the manager can have a conversation, like Zainab said, with the employee and say, you know, when the days where I've seen you most successful have been the days that you disclosed to me that you've taken your medication. Do you think it would help you more to be more consistent, to be taking it more, you know, when you come into work?
I mean, another strategy is to have him have like an alarm on his cell that kind of pops up and says, take your meds. Just to kind of like instant.
Because I think it's important the manager comes up with kind of, you know, kinds of resolution for it. You know, like, hey, I'm here to help.
Right.
Here are things like, you know, that could help you.
Exactly. Exactly. Yes.
One of you with your experiences with dealing with children and are mildly or moderate ADHD, do you see success with therapy only, or it's most of the time you can help?
Personally, I also do therapy on the side. The most success is with medication, with therapy. It's hard